Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Today, the creation of a national weather service for public health threats. Dr. Dylan George is the director of the new Center for Forecasting and Outbreak Analytics at the Center for Disease Control and Prevention. He joins Dr. Josh Sharfstein to talk about what's new at the center and what to expect during this year's respiratory viral season. Let's listen.
Dr. Dylan George, thank you so much for joining me in Public Health on Call to talk about this new center at CDC and how it's going.
Thank you very much for the opportunity to be with you.
So where do things stand?
Well, just as a reminder for most people, the Center for Forecasting and Outbreak Analytics is one of the newest centers within CDC. It doesn't happen very frequently that you create a whole new center at CDC, but our mission is to empower people to save lives and protect communities from health threats. And how we're doing that, how we're trying to create that vision of the world that we're seeing is that through harnessing cutting edge analytics to generate better analytical insights to improve response capabilities for public health emergencies. That's how we're trying to do, that's our secret sauce. That's how we're trying to actually affect this mission going forward. And it's been exciting to kind of like see that mission come into life.
Now, I kind of thought of it, you could tell me if this is the wrong way to think about it, but simply as building a little bit of a national weather service, but for public health threats. Is that fair, unfair?
No, I think that's a really strong analogy because, it's like before we had the weather service, we were battered around by severe weather events in a lot of different ways. And that's what we're trying to do right now. It's like we don't ask academics to stop their day job to help us anticipate where a hurricane is going to hit the United States. We have people that's their day job is to figure out how to save people from hurricanes. This is what we're doing as well. We're creating that kind of weather service for infectious diseases and other health emergencies.
So tell me about the kinds of health emergencies, infectious diseases. So I guess pandemics are on the list. But what else besides pandemics within infectious disease?
Yeah, we were born out of the pandemic. And so we're definitely focusing on infectious diseases to start with. And we need to figure out how to actually do that. And to be quite honest, there's going to be a lot of work there because there's lots of different pathogens that are infectious that we need to be thinking about, whether they be respiratory diseases, whether they be sexually transmitted, whether they be direct contact, or whether they be vector-borne diseases. There's a lot to do there. But I'm confident once we get our team, our tools, and our partnerships in place, we're going to be able to help out with chronic. We're going to be able to help out with a handful of other sorts of efforts.
So just within infectious disease for a second, we could be talking about the flu forecast, but we could also be talking about the malaria forecast or the gonorrhea forecast.
Exactly. I mean, we helped out with the Mpox response, and we had to work very closely with people that were doing sexually transmitted disease modeling to help understand how that would be moving around. The Mpox was moving around going forward. We're going to have to develop capabilities in a lot of different spaces and work with our colleagues that are in those spaces.
And then you also mentioned chronic illness. So beyond even infectious disease, so we could be seeing the stroke forecast or the asthma forecast?
Well, I think that's going to be a ways off, to be quite honest. Where I do see that there's going to be some real near-term sort of mutual benefit in working with chronic conditions and infectious diseases. Is we saw during the pandemic that people that had multiple comorbidities were at higher risk from severe disease and being hospitalized, but we didn't know where they were. We didn't know how to track them in different ways. So we are working actually right now to actually get a better assessment of what those comorbidities look like, who has diabetes, who is obese, where they are in the United States and how they actually interact going forward, because that will help us with infectious diseases and thinking about how a pathogen would move through a population.
Because you could say town A is more vulnerable because of certain factors in the population than town B, for example.
Exactly. That's the idea. And so it's like, that's the near term sort of interaction that we see with that is going to be mutually beneficial for both injury and chronic diseases and for infectious disease. And that's where we're going to try to focus on where we get those mutual benefits.
Not to belabor the weather service analogy here, but is there any overlap with weather? Are you thinking about the impacts of climate and how to model those on health?
Yeah, I had a really interesting conversation with the director for the National Center for Environmental Health recently, Ari Bernstein, and he was talking to me about how after forest wildfires, the number of respiratory cases increased in that season, but also in the subsequent season because of lung damage in different populations. And how, I mean, that's the hypothesis. They were seeing some of that evidence and some at the population level. We're trying to think through with Ari and our colleagues at the National Center for Environmental Health. It's like, how would we actually think about that? I mean, we're in the very, very early stages of talking about that, but that's an example of how we might be able to work together with them as well.
Well, we had just the awful air quality issues a few months ago, and you could potentially be modeling the consequences for asthma admissions and other things like that. Okay, so plenty of work to do for the CFA. Where do things stand now? Tell me about a project that just launched or you're about to launch.
So I like to describe it as like our 10x value proposition is, can we provide analytical insights for the federal government? Because there's lots of questions that need to be answered in an outbreak for the federal government. The 100x value proposition is, can we do that for state and local jurisdictions? We have taken a big, big step in achieving that 100x value proposition in the launch of what we call InsightNet. InsightNet is the first national network for outbreak analytics and disease modeling partners across the United States. We are very excited about this new advancement and this new initiative that we've just launched. And again, the name of that is InsightNet. So we're super excited about it.
Okay, so tell me, what is InsightNet?
So we have funded 13 awardees. They're private, public, and academic partners. And their main mission is there's 3 buckets of awardees. The first bucket is groups that are going to advance and create new innovative ways of analyzing data to help us understand how to navigate an outbreak. The second group is then they're going to take those innovations and test them to see, are they actually as innovative and cool as we think they are? And are they helping us make decisions better, faster, stronger in some way? The last group will then take the ones that are really helping the state health officials, the county health officials, the local health officials make those decisions much more effectively. How do we scale them to other jurisdictions that are not a part of the network already? So we're going to come up with new ideas. We're going to test those ideas, and we're going to scale those ideas and those new modeling techniques. This is a huge transformative effort to move forward in using modeling and analytical capabilities to generate a better evidence base for an outbreak. So we're very excited about it.
You're really building the toolkit for predicting critical issues at the state and local level.
That's exactly it. And I definitely want to emphasize, though, too, is that we are really trying to work very closely with our state and local health departments. There's over 35 health departments are a part of this network right now. They are critically important for us because we want to create operational capabilities, not just really interesting science papers. And that's why we're so excited to have these health departments in the network right now.
Got it. So you have the ambitious vision. Now you've got a whole set of partners, both in academic institutions, including Johns Hopkins, and in health departments. But I want to ask you a little bit more tangible question. Respiratory virus season this year. Anything you can tell me?
Yeah, we've tried to help state and local jurisdictions understand what is the burden that they're going to be experiencing over this next respiratory season going forward. So we put out what we refer to as the respiratory outlook. I'll be the first one to admit, first of all, what it is we're trying to anticipate how much hospitalization we would expect over this next season. And we've developed this outlook in partnership with our colleagues in the National Center for Immunization and Respiratory Diseases to outline those expectations of hospitalizations for COVID, influenza, and RSV over this next season right now.
Good news, bad news, something in the middle. Tell me what we're working with here.
Personally, I think it's okay news. It's not great news. It's not bad news. So what we've done is we've looked at historical data, we've looked at modeling results, and then we've also talked with a handful of subject matter experts. And so what we anticipate is that over this upcoming fall and winter season, we're going to generate more hospitalizations than we saw pre-pandemic. And that's largely due to the impact of COVID. Pre-COVID, we had 2 pathogens largely creating hospitalization, RSV and flu. Now we have 3. RSV, flu, and COVID. And COVID is generating a lot of hospitalizations this season to be similar to what we saw last season. And so that gives you a mark in the sand of what you could expect if you're in a hospital system. And so one of the things that's been very exciting about this, though, too, is that we've been able to talk with a couple of state health officials and local health officials, and they've been able then subsequent about this assessment. And then they've been able to actually go talk to their hospital systems to say, are we ready for that amount of hospitalization? If we're not, what do we need to do to get ready? If we are, that's awesome. Let's all rejoice a little bit there. But it helps people as a planning factor to think through. It's like, what are we ready for that amount or not? And think through what's needed, what's not for that level of hospitalization. It's not Omicron, where we saw just a huge wave of cases and just getting swamped. It's not like the beginning of the pandemic where we were just swamped in the early stages. But it's not going back to what we were before, so it's kind of okay.
Got it. I think I know what you mean now by okay. It's sort of like a little worse than before the pandemic. And you go like, okay, could be better, but certainly could be worse.
Touché.
Well, key question, public health is compared to what? So it's good to keep in mind. Dr. George, this is such a great update. Congratulations on building the Center for Forecasting and Outbreak Analytics at the Centers for Disease Control and Prevention. Good luck with all your new partners and for achieving this vision to create a national weather service for public health threats that can protect us all.
Thanks, Josh. Really appreciate the opportunity to be with you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.